Dr. Pip, thank you so much for being here.
Thanks for having me.
Will you tell us a little bit about your mission?
Well, I am a family doctor, or in some places you'd call that a GP, depending on where you're listening from. And I want your listeners to know that their health as a mom, as a pregnant person, and especially as a postpartum person matters. And as part of health, I want to make sure everyone knows that their mental health matters. I know that your focus is physical health, and your pelvic floor is a very physical, sometimes ailment, sometimes it's just, a management or learning about pelvic floor. And physical health is really important. But as you know from talking with people that you see in your office, so much of physical health is intertwined with mental health. And I want people to know that mental health matters just as much as physical health. So if your mental health is not where it should be, you need to make that appointment today, just like you would make an appointment for a bladder infection or to see your physio. Your mental health needs attention.
Mhm. I love that. And I wonder if you could, because as you mentioned, you're a family doctor, and will you talk a little bit about your road to, I know that you do a lot of work and advocacy around mental health. So will you talk about that, your own personal journey? I mean, with kind of starting to kind of do a little bit more specialization in that area of your practice.
Yeah, and I'll just take a sidestep here and say I'm a family doctor who's currently on maternity leave, who has three children in the room next door getting ready for lunch. So you may hear a little background noise here and there, but that's just life, right?
Mhm.
So I'm a family doctor. I'm located on Vancouver Island in BC. I am a mom of three. I have three boys, and as I mentioned, I'm on maternity leave with my third, so he's not quite 6 months. So I come into perinatal mental illness both from a medical perspective, but also, being a mom and knowing how hard motherhood can be and that transition to motherhood can be was probably the main driver actually in my interest in perinatal mental health and postpartum support. So I think my interest really grew in my own journey through birth and postpartum, where I'd had a birth that wasn't what I imagined. I wouldn't say it was particularly traumatic, but it just wasn't the birth that I had hoped for. And so there was some grief with that. I had an emergency C-section. So as you know, the physical recovery was shockingly much harder than what I was prepared for. And I mean, this is coming from a medical perspective too, right? Like I was a resident. I cared for surgical patients, over and over again. And it just had not occurred to me how hard that recovery would feel. So, I went into my own postpartum journey the first time with a lot of emotions and at times feeling sort of out of sorts with my new role in motherhood. Sometimes feeling isolated, definitely struggling with that sort of pain piece of recovery holding me back, feeling like I couldn't exercise the way I imagined myself exercising postpartum, and just a lot of feelings that I wasn't expecting. And fortunately, I was very well supported in that journey. And I stayed well. I was able to access sources of resilience and keep myself healthy and well during that transition. But it made me realize how vulnerable first time moms in particular, but all postpartum people are as they transition from pregnancy to postpartum in that motherhood, journey. So it was already kind of in my mind, like, I need to learn more about this. I feel like I don't know enough about how to identify a mom in distress versus a mom who needs more support and education and tools, because I almost couldn't even identify it in myself, right? And then at the same time, a close friend of mine reached out. She had a new baby and she was really suffering. And it became apparent that she was suffering with a postpartum depression. And so, in supporting her, getting well, seeing her doctor, accessing various supports in her community, and just being there as a listening ear, it really put this passion into play for me that, I need to be there for new moms. There's so much that new moms are not supported in. After your baby arrives, so much of the journey is baby, baby, baby. Even the way we schedule well baby visits at the doctor's office, it's so fixated on the baby that if you're not really intentional as the care provider, you may forget to actually to even ask mom how she's doing. And that's not anyone's fault. That's just the way the system is. It's the way things have always been, but we can do better. So, in wanting to do better, both by my friend, by myself, by my patients, I did some extra training through Postpartum Support International and got a certificate in perinatal mental health. And alongside that, I do a lot of independent study. I read a lot. I do a lot of webinars so that because I'm not a psychiatrist, I'm a family doctor, and I certainly would not compare my mental health skills to a psychiatrist in any way. But there's a lot that I can learn to do the best I can at the primary care level. And then the really sick patients can go see the psychiatrists who, as I'm sure everyone's aware, the psychiatrists have a lot of work on their plate as well. So if I can help to balance out some of that workload and take care of the people who, aren't sick enough to be in hospital, but do need some support, then great, that's what I want to do.
I'm curious to know, when you mentioned that after your first and you were having a hard time, but you felt really well supported. I'm curious to know, at that time, when you say well supported, did you feel really well supported by your social network, or did you feel well supported by, like, did you know what questions to ask your care provider, or were they already asking you questions, or did you have to advocate for that? I'm curious to know, because I think a lot has changed probably since you even had your first.
Yeah. Oh, yeah. Because my first was born almost 5 years ago. I think I come into it from a different perspective, being a medical person, being cared for by medical providers who are my colleagues as well as my friends, right? I'm in a small community. So I think in some ways I didn't know what to ask for or what questions to ask for or what supports I need. But my family doctor was a mom herself, and my family doctor did an excellent job. And in fact, I've told her this, the best advice I received postpartum was from her. And she said, around postpartum day 5, you're going to get really tearful. You're going to be really upset about things that seem really silly, like your tea being too cold might make you cry. This is very normal. You're okay. It'll last about 48 hours. You'll get through it. And it was such a powerful piece of advice because it happened right around day 5, day 6. That hormonal fluctuation, the breastfeeding changes, the sleep deprivation, all of it sort of collides at once. And most women have, or most postpartum people have, this event where things suddenly feel really hard and you feel very tearful and you feel overwhelmed. And most of the time we get through that within 2 or 3 days. And having that signposting and that guidance from my family doctor, who was a mom herself, who'd gone through it herself, was so reassuring, because my husband and I, we were both there when she gave us that advice. We're able to say, okay, it's okay. She told us this would happen. She told us it wouldn't last forever. And I've told this story many times on various podcasts, so people are probably bored of it. But having someone guide you through those moments that are expected to be challenging is so powerful. So between, the medical wisdom and the motherhood wisdom from my family doctor, the medical wisdom and the motherhood wisdom from my obstetrician who did my C-section, and then the motherhood wisdom of all the women around me who'd come before me, was, that's what I needed to stay on track. But I could see how if I didn't have those things, or if there were more stresses in my life, if I had financial distress, if I was a single mom, if I'd had a traumatic birth or something else had gone sideways, I could see how easily you could tip in your mental health and go down a catastrophic pathway.
I remember actually when you said that, it made me think, before we had our first, I had had quite a few losses, but the first one I remember being particularly difficult. And my family doctor in the same way talked to my husband and I, and she said to him, Melissa's going to have a really hard time with this. I just want to acknowledge Melissa, and I just want to say, don't be surprised. My husband's name's Patrick. Don't be surprised if she takes this a lot harder than you. And I just found that made me feel so normal because that happened. But I hear you say that and I think, yeah, how powerful that is. And just to normalize or just to validate. And I can't help but think that um, a lot of this is going away in some ways. I mean, with COVID and taking away so many in-person appointments and more online appointments, I think that there's so much that online appointments can offer. And I see that improving access, but I also, it takes away some of that human warmth or that connection. And I do find, you too, I'm sure, that really new moms are really missing this. And I think too, just with the healthcare system feeling the burden, it appointments are being cut short, or there's fewer of them. And so I think naturally harder to kind of connect in some of these levels.
Yeah, I think, yeah, the advent of virtual care, I think, has had many positives and many downsides. I do think, for at least I find for this population, sometimes it actually improves access, because then you
Mhm.
don't have to worry about the childcare piece. You don't have to worry about driving there. You don't have to worry about timing your appointment around nap schedules and that sort of thing. So I think it probably ultimately comes down to the relationship between the patient and the care provider and what works best between them.
Mhm. Absolutely. And one of the things I love to do on this podcast is make sure that I always tie in my perspective as a physiotherapist with whoever I'm talking with. And I picture all the parents, during pregnancy and then postpartum, that always attach me as a physiotherapist to their physical issues. So whatever they're reaching out for, aches and pains, or I want to learn about how I can think about my body and prepare it for birth. What can I think about my muscles when it comes to staying active in pregnancy? And then, wow, why am I experiencing such embarrassing symptoms after? And so, as physiotherapists, we ask so many different questions when someone comes in to kind of get the big picture. And you can always tell from the story that they tell or what they write on their intake form that there's so often a mental health component. I mean, we're not just physical beings and mental beings. It's all encompassing the same, we're all encompassing.
Mhm.
And I'm curious to know, I am definitely seeing a trend lately with you know, pe- new moms really struggling with their mental health, but I think they can't recognize, or they're having a hard time um, being able to they're thinking of it as black and white. Do I have postpartum depression or not? Do I have anxiety or not?
Mhm.
Will you talk a little bit about some of the trends that you see, or some of, if you could capture maybe how a lot of these new parents are feeling and how they present to you?
Yeah, so I mean, I think there's a good reason why people ask that question over and over again. And that's because so many of the symptoms that come with postpartum healing and sleep deprivation and role
Mhm.
transition overlap with anxiety and depression. So it can be really hard to know, like, am I just really exhausted? Am I just, and just is not a fair word. Am I lonely because I haven't seen my friends in a long time? Am I feeling understimulated because I'm at home with an 8-week-old newborn who's, I mean, they're not super interesting when they're
Mhm.
8 weeks old, right? They don't do very much. But there's so much pressure to do all these things for your baby. So I think sometimes that's why the question's being asked, is because people genuinely don't know, am I well? Am I not? What is this? What's happening? So, there's all kinds of clinical criteria for diagnosing anxiety disorders and mood disorders. But really, the first one for me is, if you're asking the question, am I well or am I not? You need to go talk to someone. Because if you're asking the question, part of you knows that something's not right. And it might not be that you have an anxiety disorder or a mood disorder. It might be that you have an adjustment disorder, which is sort of a transitional stress syndrome that's not quite depression or anxiety, but not quite the baby blues. And I'll talk to that more in a moment. But if you're asking the question, your brain is triggering you to do something, right? Or if you're not feeling yourself enough that it's impacting your ability to function in motherhood, your ability to function in your life, or your ability to enjoy your day to day, then you need to go talk to someone. And usually that someone should be your family doctor. Now I recognize that in BC and Canada, many people don't have a family doctor anymore. And this is a huge problem. So if you don't have a family doctor, that might have to be a walk-in clinic doctor. It might have to be someone you don't know well. Maybe you can start with a counselor if you have access to a counselor, but someone outside of you needs to know that you're having that conversation in your head about, am I well or am I not? Because it could escalate and it might get to a point where you're not able to help yourself anymore.
Mm-hmm. And do you also suggest then for people listening then that maybe for whatever reason they don't have a great relationship with their doctor, or that's maybe not the person they think of first, at what point do you suggest that talking to someone else is enough? Or I know it's absolutely important that someone reach out to a professional, but I think there's sometimes barriers to that, as you just mentioned. And when do you suggest then that people start with something like get out for a walk, or pass your baby off to someone else, or talk with a friend, or join a social network? I'm curious to know your thoughts on that.
Always.
Mhm.
So, I mean, when we go into the postpartum period, we should have all of those things ready to go. And those examples you use can be encompassed by the analogy nests. So, it's basic self-care. N is for nutrition, E is for exercise, S is for sleep, T is for time for yourself, and S again is for social support. So those are our 5 pillars of keeping ourselves well all the time, whether or not we have a mental illness, whether or not we're under a lot of stress, whether or not we're sleep deprived from a newborn, whether or not we're pregnant. Those are things we should all be trying to do for ourselves all the time. And they protect our physical health, but they also protect our mental health. And so those things should be there from day one, ideally. Granted, it's very hard to access those things when you're home alone with a baby all the time, when you're recovering from a C-section. Maybe you've just moved. Maybe you're still anxious about, COVID exposure in your newborn. Maybe you have a high-risk baby who you don't want around other people. All of those things are valid. In some way, finding examples of how you can incorporate some adequate nutrition, some exercise, some rest, some time to yourself, some social support will do you a lot of good and potentially be protective from your mental health deteriorating. It's not a cure. If you're sick, you're sick, you need to go talk to someone and you need management. It's potentially protective, and at the very least, it's supportive if you do require more interventions like counseling or medication.
I love that you bring that up, because I think sometimes it's so hard as a new parent to even think clearly. So I think that gives people to maybe make a little list and write down that acronym and think, which is the low hanging fruit for me, right? Can I think about how I'm eating a little bit? Exercise is one I'm always interested in, because I think that there's so much fear around getting any type of activity early postpartum. And I think that this is where someone like myself can be helpful, in that I also don't suggest that you go for a run or that you do boot camp, but exercise can be much simpler than that, and just moving your body in a way that feels good, whether it be gentle stretching or yoga, or, a short walk. But I think sometimes the message is don't do anything. And then, especially for people that really find exercise to be a mental health outlet, this is such a difference for them. But they're not sure what to do. So,
Mm-hmm.
um, and then, sleep. I am curious to know your thought on this, Dr. Pip. So I had a client recently, and she was actually reaching out pretty early postpartum to be proactive. She was feeling a lot of heaviness and pressure down below, which she described in her undercarriage. And every time I talked to her through an online call, she was kind of bouncing on a ball, because my baby just loves this. And as we started talking, she was doing this a lot, she mentioned, and I said, I get it. You need to keep your baby happy, but I wonder if we could get you horizontal a bit more often, because I think just being up all the time is just a lot for your pelvic floor. So I wonder if, like, keep your baby, but could you lay down a little bit? Would she be happy? you know what? She said, I'm worried though. I'm so tired that if I fall asleep with my baby on me, I've seen the guidelines that we're not supposed to sleep with our baby. And I thought, oh, I get that now that like,
Hmm.
I think a lot of your heaviness and pressure is from being on that ball all day, but oh, shoot, you're scared to fall asleep.
Hmm. Hmm. Yeah, and I think, I mean, that's a whole other kettle of fish, is talking about co-sleeping and contact napping and baby sleep. I think that newborn and infant sleep is flabbergasting as a new parent. You know, you hear it like, oh, you'll be tired, babies don't sleep. But really, babies don't sleep very much in long stretches of time. They actually sleep in a 24-hour period of time a lot, but usually they're in short little snippets. So by the time you've gotten your baby settled down for a nap, you may just have time to shower, you may just have time to eat, and then they're up again. And that eventually does become easier, and they start to sleep a bit more consistently. But especially in those first, the fourth trimester, really, when baby wants to be attached to mom all the time, the sleep needs and the sleep support is really heavy. And that fear of falling asleep with your baby and that fear of safe sleep in general is a huge anxiety trigger. And I think that's probably a separate episode, really,
Oh,
to talk about
and
safe sleep and co-sleeping or not to co-sleep. But anxiety around sleep is huge, because when you are tired, you're more anxious. When you're anxious, you don't sleep. When you don't sleep, you become more anxious. And it just spirals and spirals and spirals until you can't see the forest through the trees. Like this example of, like, oh, my pelvic floor hurts and I can't get off my pelvic floor because I can't put the baby down, right? Like
mhm.
it's so intertwined and hard to kind of step out of when you're in it.
Oh, and I think the point I was making there is that I think this is one of the themes that I see from clients, is just that there's information overload, right? Which is anxiety creating. But I think that what she's trying to do, she's hearing that I should proactively think of my body and my recovery, but then I'm also hearing about this sleep issue. So I think sometimes this massive influx of information we're experiencing lately makes it hard to prioritize our needs, right?
Hmm.
Because I'm listening to this piece of information and then, oh, shoot, but there's this one. So I think that, that in itself is so anxiety provoking. It's hard. I'm finding that this population is finding themselves really overwhelmed.
Yeah, overwhelmed. Yeah. And
Yeah.
I think it is important, when sifting through all of the information that's out there, the priority needs to be mom in mind. Because if mom is unwell, baby cannot thrive and be truly well, right? If mom is not well, bonding is impacted, decision making is impacted, the family can be impacted. So while there's a ton of information about, sleep train, don't sleep train, solids, purees, whatever, those are all baby led decisions. At the end of the day, the most important decision is what's going to keep mom well, what's going to keep baby safe. Everything else will work itself out in the wash, right? Babies come from all sorts of different walks of life and you know thought circles around how to raise them, how to navigate sleep, what to feed them. One day your 2-year-old's going to eat a french fry off of the floor of McDonald's. Everything is going to
Yeah.
seem irrelevant eventually. In the moment it feels very heavy, but the priority needs to be mom's wellness, baby safety.
I think that ties in nicely to the next part of the acronym, like the T, time to yourself. And this is something, again, when people come to see me for their physical needs, quite often my suggestions involve taking time for themselves to do something for themselves, whether it be rest or be quiet, like have quiet time, or, to down train the nervous system or do some type of exercise. I can see that people really struggle with that. And, oh, you don't understand, Mel. Like, I don't have time. And I would say, I do understand, because I still feel like that. I'm a mom too. Um, and I think that it's so much guilt, so much around, well, I need guilt around taking time for ourselves. And I always try to tell people, if you could spin it to that you're modeling self-care, because, I know that you want your child to take care of themselves. I just know that about you. And that's something that you will value in being a parent, teaching your child to take care of themselves. And so if you spin it to, instead of I'm sorry that I'm doing this, or I'm sorry that I have to do this, but being able to spin it. And I, at a very young age, I would say to my kids when they'd say, Mom, don't go out for your exercise. Let's play this game. And I always felt a lot of guilt. I still do, but I always spin it to, this makes mom feel good. And then I think you'll notice that I enjoy the game more when I go for my
Mhm.
exercise first, or, oh, mom's going to do her meditation because it helps me feel less stressed or what have you. um, I'm modeling that. And yes, it's time away from them, but I think they definitely see, both my husband and my kids see that I am better for that, to
I
spin the
think the
narrative.
Yeah, and I think also the other really important part here is that partners need to step up with this, right? Because, without being too gender stereotypical, as women, we are very quick to prioritize the needs and self-care of our children and our partners before our own, right? If something's going to go, it's going to be mom's walk around the block. It's going to be mom's time with friends before even dad's time with friends. And again, this isn't a very heteronormative situation, but typically that is the way it works in most families, and that's cultural teaching, that's modeling that we've seen growing up, and we need to stop that. So part of it as women, we need to be confident in our own needs to take that time and to not just ask for the time but expect the time. The other part is our partners, if they want us to be well, if they want us to be, the well-rounded humans they fell in love with, they also need to expect us to take time for ourselves. And so this is partly a mom issue. This is mostly a family issue. This is mostly a couple issue. I recognize that in some families where partners work away at camp or military or what have you, the circumstances may be different, but in the vast majority of families, there needs to be some sort of discussion to allow both parents to access self-care time, time away from the home, time away from the kids. And the important piece with mom is that she's not doing errands on her self-care time. She's not swinging by the grocery store on her way back from the gym. That's her time to do what she needs to do. And we need to expect that from each other as partners.
I've made the analogy before that, I mean, as beautiful as birth it is an injury to our tissues. And so if you think about other, let's say, planned surgeries or injuries, there's always this rally around the person, like, okay, dad's going to be off, he's having his open heart surgery, or dad's having a knee replacement, so the whole family plans around that for the year. And dad's going to, maybe we'll give dad a bell he can ring when he needs us, but he's going to be like elevating his leg, and he's probably going to be watching a lot of TV, and we just know that we're going to plan around that. But it's very different after having a baby. It's funny how I think there's this lack of acknowledgement that, because the baby takes up all the new space, right? And that oh, like mom's been through this, like this is
Mhm.
something big that she's been through, but we don't have the same rally around the recovery. I think part of it's that, again, it's just kind of blows everyone out of the water, the difference in life. And I respect that, but I think going into it with those expectations, and maybe whether it, you whether it be that you ask for more help, or that you have to check in daily to say, how did you feel you rested today? Do you think we need to ask for some more help? Or maybe some daily check-ins, like, what do you think you need?
Mhm.
Was that a good amount of rest? Do you feel like you need more? Or,
Yeah.
because I think it's hard to know for sure, but I do think it, like you mentioned, it all becomes about baby without the acknowledgement that this has also been an injury.
Mhm, mhm. And also with the birth of a baby, there's the birth of a mother, right? Like
Mhm.
you are born into a new role, and parts of you are still there, but parts of you are always going to be different, and that comes with a lot of stress and angst. Like think about puberty, right? Adolescence, where we go from being a child to an adult. It's years and years of transition, and we culturally accept that, yeah, sometimes teenagers are a pain in the ass because they're going through a lot. Their bodies are changing, their hormones are changing, their circumstances are changing, their responsibilities are changing. We accept that, and we give them space to go through that, and we don't have, I think it's improving, but we don't have the same level of respect or space for mothers going through a very similar transition, physically and in their role. Everything's shifting.
Mhm.
So we need to give space for all of that.
And then I keep coming back to this acronym that you mentioned. The last thing kind of being, would you say S is social networks? Is that what you said? Like, so
Yeah, social support.
social support. So I think that now I think a lot of people reach out to social media for social support, because I'm actually seeing this huge influx of posting in Facebook communities, some very deep questions or some very vulnerable topics that just makes me think, oh, did these people not have friends that they can reach out? Like, they're reaching out to strangers, and which I admire, that people feel that they can get that off their chest. But I think everybody's social network or social support is very different. Some people are a little bit more focused on family. I think it's harder for people to get out and see friends in person, but I think that can look different for anybody. And I think unfortunately, I think sometimes we look at social media and the glorification of what people post and think, well, they're all doing so awesome because look at their pictures and I'm clearly not, so I'm just going to stay here.
Mm-hmm.
Right. And I think that's a big struggle right now too. But most people notice, as soon as I got out, it was such a struggle to get out, but I feel so much better hearing I'm not alone.
Mm-hmm, mm-hmm. Yeah, and I think a good rule of thumb is if you're about to go on Instagram or Facebook to, troll your internet friends, before you do that, text one of your real friends, right? Text one of your real life friends, even just to say hi, or maybe it's to form a connection, maybe it's to meet for a walk or a coffee. But before you go seeking information or validation or what have you from your social networks and your internet friends, find that connection with your real friends or your family, people that you're on a texting or phone call basis. Just make those in-person connections as best you can.
Mm-hmm. So I I think of like a couple examples of people that I've had recently. Lots of new moms reach out because they're maybe having aches and pains. I have neck pain, or I have down in my pelvis, or back pain, or core pain, whatever they're describing. And yeah, quite often, as I mentioned earlier, some of my suggestions involve them taking time for themselves. Um, what are your suggestions then? I mean, you've already mentioned that, you need to think about yourself, but I think what you're saying is maybe take a look at the low hanging fruit, and like of that acronym that you mentioned, the nests. Can I think about any of those, and to be able to be able to think about myself a little bit more. But do you have any other suggestions for people that are having a hard time thinking of themselves, or putting themselves first?
I mean, it's a practice, right? Like everything we do in terms of self-care is a practice. I don't wake up one morning and suddenly have the capacity to run a marathon. I practice running until I can run a marathon. I can't run marathons, just as an aside, but it's,
Yeah.
it's a good example, right? Self-care is the same. You're not going to go from, doing nothing to meditating for 90 minutes every day, or taking a painting class. Start small, start with 5 minutes every day, work up to 10 minutes. Maybe you just go shut the door and read your book for 10 minutes while baby's in the care of another adult. And maybe you go for a walk around the block by yourself. It doesn't have to be big and elaborate to start. And in fact, with a newborn, it probably can't be, right? With infant feeding, physical recovery, you probably can't expect a 90-minute yoga class right off the gate, but you can expect a 10-minute walk.
Mm-hmm.
Right? It doesn't have to be fancy. It just has to be something, at something ideally that connects you with pieces of yourself before you became a mom. But sometimes we have a hard time knowing what those pieces of ourself were once we've gone through a big transition, or maybe those pieces don't matter anymore. Something that resonates. For me, it's usually exercise or a book. So if I'm not in a place to exercise, I will go shut myself in my bedroom and read a book for 10 minutes. And it helps me feel reconnected to myself, because I've always loved to read.
And you already mentioned that there's this birth of a new mom. Relationships are different. Our body is different. Our own self is different. Our routine is different. Everything is different. And I do think that, and everything that we used to do is different. So I think that like you said, people are really searching afterwards for like, gosh, like I'm so out of sorts. And I find that's an exercise I often suggest people do. Or what are the things you did before that made you you? What did your weekly schedule look like? What are some of the things that really made you feel good? Some of them might not be like going out to the bar and drinking all night might not be very attainable right now, but I'm sure that there's other things that, like you said, whether it be exercise or time alone or being in nature, just make a list and start to look at which ones can I do right now? Which ones can I maybe work to later? Because I think it is just a bit of a reflection. And again, sometimes I think we are always looking outside for the answer instead of inside. And I find that when you really ask people to kind of look inside, or what are you feeling you need, because it's not necessarily the same as someone else. um, I do find, again, this big influx of information is really making people look outside themselves for answers, and sometimes
Mm.
being able to self-reflect can be very helpful.
Yeah, and I think you're also speaking to, I mean, anyone who follows me knows that I really appreciate the teaching of Eve Brodsky and her book Fair Play and her more recent book, Unicorn Space. And in the book Unicorn Space, she talks about how hard it is for women in particular to identify with anything outside of their roles. So their role as parent, professional, and partner. And sometimes that's why it's hard to know what you used to enjoy, because maybe everything you did was tied to a role that you had. For a lot of people going from working life to maternity leave, a lot of what you did was probably tied to your role as professional, whatever your working situation was. And coming into this time where you're not identifying as a professional to the same extent because you're on leave with a baby can feel very unsettling. And it can feel like, well, who am I? What do I do? What did I do with my time? Maybe my friends are all tied to my work, and the way I feel good about myself is tied to achievement through my work. And kind of just finding ways to navigate that transition can be, you know a big shift. So trying to find little pockets of things that help you feel like you, that are not tied to your roles in the world, can be hard, but it requires time, it requires intention, it requires, sitting down maybe with a notebook or a journal. Maybe ask your mom, mom, what did I do in high school that I liked doing before I had all these roles? Sit down and do a little bit of soul searching. You don't have to find some sort of magical answer, but there's something in there that makes you you. That's not work. That's not your role as a partner and not your role as a parent.
And I think that advice will serve you well for the rest of your life, because there's other times in our life we go through such big transitions, whether it be retirement or
Retirement.
menopause, that I think
Hmm.
you'll really find that practice is helpful.
Yeah.
So, Dr. Pip, if I picture the people listening to this episode, I think many of them will be care providers that work with this population of new moms. Any kind of final messages to them, any of them listening?
I think the most important thing as someone who works with this population is to always recognize the enormity of the transition from pregnancy to postpartum, that motherhood journey, or what we sometimes call matrescence. It's huge. And I think sometimes in a healthcare system where we're constantly time pressured, where we're constantly being asked to see more patients, more people, provide more care, do more, we sometimes forget that what seems like sort of a benign, like, oh yeah, it's a new mom, I see new moms all day long, situation, to us as the care provider, that day that that new mom made it to your office to see you for physio or counseling, or pediatrician visit, family doctor visit, what have you, that may have been the first day that she left her house without her partner. That may be the first day she's out in public with the baby. It might be the first day she breastfed in public. Like, the enormity of this transition is so huge to the person in it, and to the rest of the world we don't always see that. So do your best to help mom feel seen, because in her world, she's not being seen a lot of the time. Baby gets seen, she does not. So, any effort to check in with her, and really check in with her, how is your transition to motherhood going? I've spoken with other clients at this same stage who find the 4-month sleep regression really tricky. How are you managing that? Just find a way to normalize their time in motherhood and connect over it, because I guarantee you most of the time the only connection that's happening in her life is around the baby, right? Out in the grocery store, oh, how old your baby? Your baby's so cute. It's always baby focused, and babies are cute, they're lovely, but mom matters too.
I really make a point to that when people come to see me and they bring their babies. It's a very small amount of time looking or talking to the baby because I want them to make sure that this is an appointment for them.
Mhm.
What about the the new moms that are listening? Any final messages for them?
I think, as you'll hear me say over and over again, your mental health matters, and you're still a good mom if your mood or anxiety needs management in the postpartum period or in pregnancy. You need to be well for yourself and for your family. And so your wellness needs to come first. If you feel like something is slipping, if you feel like you're tearful more than you should be, like you're angry more than you should be, like you're anxious more than you should be, go talk to someone. You matter. It doesn't mean that you're a failure. It doesn't mean that someone's going to put you on medication right away. You just need to talk to someone and get the ball rolling and get some support on board, because you matter, and you matter to your baby. Every baby deserves a happy, healthy mama, and every mama deserves to have a happy, healthy transition into motherhood. It's heartbreaking to think of how many people sit in isolation and feel anxious and sad and lonely in such a huge time of their lives. And you don't need to do that. There's help available, and with help, you will be well.
You're amazing. And I want you to let people know some of the work that you're doing and where they can find more from you.
Yeah, so most of what I do really is in most of what I do outside of practice. So, on the interwebs online is really just in education and advocacy. I post on my blog, I post on social media. Most of that stuff I do is just out of the, passion in my heart for people to feel less stigmatized in this journey. I do have a podcast. I did a little limited series, which was supported with some funding locally here, and that was focused on sharing stories through mental illness and back to wellness. And you can find that at the Making Mama Well podcast on my website and anywhere you listen to podcasts. And on social, you can find me at Making Mama Well on both Instagram and Facebook. That's where you'll find most of my content. I love creating content. I love talking about this. And then in my day to day, right now I'm on maternity leave. I am just figuring out what return to work is going to look like. But I do hope to grow, maternal mental health support as part of my practice when I'm back at work. But I also have a little baby at home, so that's a little whiles away still.
Mhm. Well, thank you for everything you're doing and thank you for your time
Thank
today.
you.